Hello and welcome to Health Exec TV. We're here today with Sara Parker, who is the Deputy Business Manager at North Cumbria University Hospital's NHS Trust. Sara, thanks for coming in. Firstly, what were you looking for from an appointment confirmation service, and why was Chronos the most appropriate one, and why did you choose it?
We were reviewing our outpatient services generally, looking at the patient experience aspects and some of our performance indicators. And in particular we were looking at our did not attend rate, our DNA rate, which was higher than we wanted it to be. So we were trying to get our DNA rate down to about 7.2%, and it was currently at 8.4%. We looked at Chronos, and they were one of the only systems out there that offered text reminders and automated calls and emails and an agent caller. We also spoke to some other trusts who'd used them before and had a positive experience, so that was the main reason for using them.
So what is your personal experience of Chronos from a business perspective?
They've been a very professional company to work with. They've worked with lots of NHS trusts, and acute trusts in particular, so they knew kind of the business that we were in and what our expectations were of the company. The project management around it was very good. There was communications material provided, so leaflets were written for us and poster images and text and everything provided. Communications plans, and they'd learnt all the lessons really that other trusts had learnt, so we didn't have to learn them painfully ourselves.
And probably most importantly, how has Chronos been received by your patients?
Very well. We ran a pilot initially and then did a survey from that. We audited about 100 patients who'd received messages from us, and 90% of patients thought that their messages were a good idea, and 88% thought that they were clear and easy to understand. So that was very good feedback.
And more specifically, how do the service callers benefit the service given to your patients?
Well, we use a mixture of text messages, the automated calls, the IVR calls, and then if the patient fails to interact with those a couple of times because they're having difficulty with it for whatever reason, we switch to an agent caller. So we find that the patient ends up with a much better experience of the service if they've actually spoken to a human being on the line at the end of that. So they're a very positive addition to the service.
And last but not least, what efficiency and capacity differences and benefits have you seen in the Trust by using the Chronos system?
Overall, we've reduced the DNA rate by about 30%, up to 50% in some specific specialties. So I think if we looked at November, just gone to the November previously, before we implemented the system, we're getting about 600 extra patients in a month into our clinics, so it makes a big difference.
Sara, thanks very much for coming in, and good luck with the future.